Cognitive behavior refers to the way our thoughts, cognitions, and actions, behaviors, interact and influence how we feel and function in daily life. It's the foundation of cognitive behavior therapy, CBT, which is based on the idea that our thoughts affect how we feel. Our feelings influence how we behave. Our behaviors can reinforce our thoughts, creating helpful or unhelpful cycles. For example, if someone thinks, "I'm not good enough," they might feel anxious or sad, which could lead them to avoid social situations. That avoidance then reinforces the belief, "See? I can't handle it," and the cycle continues. CBT helps people identify and challenge unhelpful thoughts, and replace them with more balanced, realistic ones, which in turn can lead to more positive behaviors and emotional outcomes. It's widely used to support people with depression, anxiety, trauma, and even physical health conditions where mindset plays a role in recovery. Common cognitive symptoms these relate to how a person thinks, remembers, and processes information, memory loss or forgetfulness, difficulty concentrating or making decisions, confusion, especially in new environments, trouble planning or completing tasks, language or speech difficulties. Common behavioral symptoms these are changes in how a person acts or responds to situations, withdrawal from social or daily activities, repetitive behaviors or speech, irritability or mood swings, avoidance or refusal to engage in tasks, changes in sleep, appetite, or hygiene. These symptoms can appear in conditions like depression, anxiety, dementia, or trauma-related disorders, and they often overlap. For example, someone with major depression might show both cognitive symptoms, like slowed thinking, and behavioral ones, like staying in bed all day. Cognitive behavior therapy, CBT, is a structured, evidence-based psychological treatment that helps people understand the relationship between their thoughts, feelings, and behaviors. It's grounded in the idea that how we think about situations influences how we feel and what we do, so by changing unhelpful thought patterns, we can change our emotional responses and behaviors too. Here's a quick breakdown of how CBT works. Identify unhelpful thoughts. These may include negative self-talk, distorted thinking, such as catastrophizing or black-and-white thinking, or core beliefs formed from past experiences. Challenge and reframe. You learn to question whether these thoughts are accurate or helpful, and to replace them with more balanced, realistic alternatives. Practice new behaviors. CBT encourages testing out alternative ways of thinking through real-world behavioral experiments, reinforcing positive change. It's commonly used to treat anxiety, depression, PTSD, phobias, and even chronic pain or insomnia, and it pairs beautifully with mindfulness and creative therapies. Cognitive behavior therapy, CBT, uses a toolkit of practical techniques to help people shift unhelpful thought patterns and behaviors. Here are some of the most widely used ones. 1. Cognitive restructuring, or reframing. This involves identifying distorted thinking, like catastrophizing or overgeneralizing, and challenging those thoughts to develop more balanced alternatives. 2. Behavioral activation, often used for depression. This technique encourages scheduling enjoyable or meaningful activities to counteract withdrawal and low mood. 3. Thought records. Clients track situations, emotions, automatic thoughts, and alternative responses to build awareness and practice reframing in real time. 4. Exposure therapy. Gradual, controlled exposure to feared situations or stimuli helps reduce anxiety and avoidance behaviors, especially in phobias or PTSD. 5. Problem-solving training. Clients learn structured steps to approach challenges, improving confidence and reducing overwhelm. 6. Socratic questioning. Therapists use guided questions to help clients examine the evidence for and against their beliefs, promoting insight and cognitive flexibility. 7. Behavioral experiments. These are real-life tests of beliefs. For example, if I speak up in a meeting, I'll embarrass myself, to gather evidence and challenge assumptions. 8. Relaxation and mindfulness techniques. These support emotional regulation and help clients stay grounded when working through distressing thoughts. These techniques can be tailored to individual needs and are often blended with other approaches, like art therapy or trauma-informed practices, to deepen their impact. In addition to the core CBT techniques we've already covered, there are several other powerful tools that therapists and coaches use to support change and insight. Here are a few more you might find especially useful. 1. Guided discovery. This involves gently questioning clients to help them explore alternative perspectives and uncover underlying beliefs. It's like helping someone become a curious detective of their own mind. 2. Imagery-based techniques. These include visualizing feared situations, imaginal exposure, or using positive imagery to reinforce strengths and coping strategies. Great for clients who respond well to creative or sensory approaches. 3. Core belief work. This goes deeper than surface thoughts to address long-standing beliefs like I'm not good enough or I must be in control. Techniques include belief testing, schema work, and compassionate reframing. 4. Values clarification. Clients explore what truly matters to them, which can guide goal setting and behavioral choices. This is especially helpful in recovery coaching or when motivation is low. 5. Role-playing. Practicing difficult conversations or new behaviors in a safe space helps build confidence and reduce anxiety. 6. Activity scheduling and mastery logs. These help track progress and reinforce a sense of achievement, especially for clients struggling with low motivation or self-worth. 7. Graded task assignment. Breaking down overwhelming tasks into manageable steps to build momentum and reduce avoidance. 8. Acceptance strategies. While traditional CBT focuses on change, newer approaches like ACT, acceptance and commitment therapy, integrate mindfulness and acceptance to help clients relate differently to distressing thoughts. Cognitive behavior therapy, CBT, stands out for its structured, present-focused, and goal-oriented approach, but it's just one of many therapeutic modalities, each with its own strengths depending on the client's needs, preferences, and goals. Here's a quick comparison of CBT with some other common approaches. What makes CBT unique is its emphasis on practical tools and measurable outcomes. It's often shorter term and highly adaptable, which is why it's frequently integrated into coaching, PBS, and even art therapy frameworks. That said, many practitioners blend techniques, for example, combining CBT's thought challenging with ACT's values work or DBT's emotion regulation. Hybrid approaches that combine cognitive behavior therapy, CBT, with other modalities are becoming increasingly popular, especially for clients with complex or layered needs. These integrative models draw on the strengths of CBT, like structure, goal setting, and cognitive reframing, while weaving in complementary techniques to deepen emotional insight, enhance flexibility, or support trauma recovery. Here are some compelling examples. 1. CBT plus psychodynamic therapy known as integrative cognitive therapy. This approach blends CBT's present-focused strategies with psychodynamic exploration of unconscious patterns and early life experiences. It's especially useful for clients who benefit from both symptom relief and deeper emotional insight. 2. CBT plus dialectical behavior therapy. DBT builds on CBT by adding mindfulness, distress tolerance, and emotion regulation skills. This combo is powerful for clients with emotional dysregulation, such as those with borderline personality disorder or complex trauma. 3. CBT plus acceptance and commitment therapy. ACT shifts the focus from changing thoughts to accepting them and committing to values-based action. When paired with CBT, it offers a flexible toolkit that balances cognitive change with psychological flexibility. 4. CBT plus mindfulness-based cognitive therapy. MBCT originally developed to prevent depression relapse. MBCT integrates mindfulness practices with CBT techniques. It's ideal for clients prone to rumination or chronic stress. 5. CBT plus eye movement desensitization and reprocessing. EMDR for trauma work. CBT can be paired with EMDR to address both cognitive distortions and somatic memory processing. This hybrid is often used in PTSD treatment plans. 6. CBT plus art or narrative therapy, especially relevant to your interests. This blend allows clients to externalize thoughts and emotions creatively, while still applying CBT's structured reflection and reframing. It's a great fit for trauma-informed or neurodivergent clients. 7. CBT plus schema therapy. Schema therapy expands CBT by targeting deeply rooted patterns, schemas, formed in childhood. It's particularly effective for personality disorders or long-standing relational issues. Here are a few compelling case studies that illustrate how hybrid CBT approaches are applied in real-world setting. CBT plus compassion-focused therapy, CFT. A case study involving an older adult with complex mental and physical health issues combines CBT with CFT to reduce depression and anxiety. The therapist employed a case formulation approach to tailor interventions, blending cognitive restructuring with compassion-based imagery and self-soothing techniques. This helped the client shift from harsh self-criticism to a more nurturing internal dialogue. CBT for insomnia plus ACT for chronic pain. In group treatment model, clients with both insomnia and chronic pain received a hybrid of CBT, sleep education, stimulus control, and ACT, mindfulness, values-based action. The result? Significant improvements in sleep efficiency, pain acceptance, and reductions in anxiety and catastrophizing. This model showed how blending structured CBT with ACT's flexibility can address both physical and emotional distress. Self-regulation CBT, SRCBT, for difficult-to-treat depression. A client with recurrent, treatment-resistant depression benefited from a high-dose SRCBT model that integrated first, second, and third-wave CBT elements. Over a 10-month acute phase and a 15-month maintenance phase, the client experienced improved mood stability and reduced reactivity to setbacks, despite previous non-response to standard CBT. Cognitive behavioral therapy focus, identifying and changing unhelpful thoughts and behaviors. Best for anxiety, depression, PTSD, OCD, insomnia, and behavior change. Psychodynamic therapy focus, exploring unconscious patterns and past experiences. Best for long-standing emotional issues, relationship patterns, and self-awareness. Humanistic therapy focus, emphasizing personal growth, self-acceptance, and authenticity. Best for self-esteem, identity, existential concerns. Dialectical behavior therapy, DBT focus, combining CBT with mindfulness and emotional regulation skills. Best for borderline personality disorder, emotional dysregulation, self-harm. Acceptance and commitment therapy, ACT focus, encouraging acceptance of thoughts and commitment to values-based action. Best for chronic pain, anxiety, depression, and life transitions. Mindfulness-based therapies focus, cultivating present moment awareness and non-judgmental acceptance. Best for stress, relapse prevention, anxiety, depression,